Hello, I'm Dr. Whipple. I'm one of the 2 bariatric surgeons here at Memorial Health. I did my fellowship, which is an extra year of subspecialty training, specifically in bariatric surgery and advanced laparoscopic surgery at the Cleveland Clinic back in 2004. And after completing that, I came back to Memorial and been in practice as a bariatric surgeon since that time.
I'm Dr. Robert Kelly, a board-certified, fellowship-trained bariatric surgeon here at Memorial Health. As a minimally invasive surgeon, I specialize in performing robotic operations. Robotic surgery allows me to create tiny incisions, minimal pain, and offer my patients a very fast recovery. During this presentation, I would like to tell you about the surgical options for weight loss surgery. While surgery, like the sleeve gastrectomy, is a very good option for many patients, I also specialize in medical weight loss with the use of medications and dietary management for those patients seeking a non-surgical option.
Here at Memorial, we are an accredited center for bariatrics. We earned this accreditation more than 10 years ago and have worked hard to maintain it.
We are a bariatric program of distinction with phenomenal safety records and our attention to patient care and detail. As a center of excellence, we are a program made up of many individuals who care for the patient, not only in the preoperative phase of their care or before surgery, but through surgery and thereafter, with expectations to see our patients throughout their lifetime.
One of the most important things to understand about bariatric surgery is it's not just an operation. There's a lot more to this than just the operation itself. And it's very important to understand the team that will engage with you as you move through this process. We have a group of experts in weight loss surgery and in patient care for people dealing with that to help you through this entire process. We have 2 dietitians, 2 mid-levels, patient navigators, a whole group of people with expertise to help you get through this, because there's a lot of preparation that you'll need to do before you're ready for the operation, and then things are very different for you afterwards. So we have this group of individuals put together that have an expertise in this to help you navigate the changes in your life as you move through this entire process and lose the weight and learn to make much healthier habits. It's important to know that we're so committed to educating you before surgery. This will be very different than any other operation that you've had before. If you were to have a hysterectomy or your gallbladder out, you basically come in and see the surgeon maybe once or twice and you go to the operating room within a few weeks. That's a very different process that we use for bariatrics. There's a lot more education to prepare you for the changes that you're going to encounter after the operation. What we want to do is make sure that we have looked at everything individually and prepared you for the operation to maximize your chances for success after the surgery. It really boils down to a simple fact. Once you hit a certain weight, diet and exercise alone just isn't effective. And everybody hits that wall when the BMI hits a certain level so that you are no longer effective at getting the weight off. So you'll work really hard, diet and exercise, and lose 15 or 20 pounds. But unfortunately, when you come off that diet, a very predictable pattern kicks in. And not only do you put back on the weight you lost, but usually it comes back with 4 or 5 new pounds. And it's as this pattern repeats over and over again, that's when we get into this vicious cycle where you just can't get the weight off and keep it off. So the reason bariatric surgery becomes necessary is to break that cycle, get the weight off, and reset your body from a metabolic standpoint. So that's why bariatric surgery is different from dieting alone. It really helps you break that cycle. But the weight's not the only reason that we're doing these operations, and it's not even the most important reason we're doing these operations. We do these operations in order to impact the medical problems that come on because of the weight. The 3 most common medical problems we see associated with obesity are going to be type 2 diabetes or adult onset diabetes, high blood pressure, and obstructive sleep apnea. We also frequently see problems with elevated cholesterol, reflux problems. Oddly enough, there's several cancers that occur much more frequently in the obese population than in patients with a healthier weight. Also, for women of childbearing age, infertility is more of an issue. Preeclampsia is more of an issue, and fetal mortality is actually a bit higher too. So if we can get the weight off, it really impacts so many medical problems that patients have. So our goal with bariatric surgery, and the reason it's necessary, is to get the weight off, to reduce the risk factors, to get rid of those medical problems, so you add not only years to your life, but quality years with a much better overall health.
You can go on our website or simply Google and type in BMI calculator. It'll ask for your height, it'll ask for your weight, and then of course, it spits out a number. What are we looking for to know if a patient is a candidate for surgery? All patients with a BMI greater than 40 are considered candidates. However, patients who have a BMI between 35 and 39.9 also are candidates for surgery if they have one of the three big comorbidities: sleep apnea, diabetes, or high blood pressure. When patients begin the bariatric process, the first thing we must do is decide who is a candidate. The NIH, or the National Institute of Health, so to speak, the governing body of medicine, has given us guidelines. The most important guideline is BMI, or body mass index.
Here at Memorial Health, we offer 3 different procedures for weight loss surgery. The most common procedure that we move forward with is the sleeve gastrectomy. It's also the most common procedure done in the US at this time. Sleeve is a very safe and effective operation. The second most common procedure that we perform is the laparoscopic gastric bypass, and the third type of operations that we perform are revisions. So sometimes patients come to us that have already had an operation and are having trouble with it, and Dr. Kelly and I will go in and correct those problems as well.
Let's begin talking about the sleeve gastrectomy. I call it the 21st century stomach. While, as humans have been made, we are able to consume between 1,500 and 2,000 calories with a normal meal. Following the sleeve, or narrowing of the stomach, patients feel full after 500 calories. That clearly allows you to end your day eating around 1,500 calories, which is necessary to ensure good weight loss. Patients often ask, what are the risks if we do go through this and we have bariatric surgery? Fortunately, the risks are very low. With the sleeve gastrectomy, all risks are less than 1%. What are those risks? Bleeding, infection, injury to organs, and most importantly, leak. We check every patient, every operation to ensure there is no evidence of leak. When patients ask me, well, what's really the risk? I usually tell them this operation, in a fellowship-trained bariatric surgeon's hands, is safer than taking out your gallbladder. That has been proven, and it gives patients a real-world idea of how safe is this, and it lets the family relate to the process as well. Usually within the first 2 to 4 weeks, we see between a half a pound and a pound every day. I normally tell patients it's not uncommon to see 60 pounds in 6 months, 80 pounds in 8 months, over 100 pounds between a year to a year and a half. We also perform the laparoscopic gastric bypass. That is a surgery in which we make a small pouch out of the stomach and essentially rearrange the intestines. What does it all mean? When a patient eats, food goes into the small pouch, creating a sense of fullness or satiety, and then the food bypasses, if you will, the first third of the intestinal tract. That creates malabsorption, meaning it's hard for the body to absorb all the calories a patient has eaten. And so the bypass works in 2 ways. It limits the patient's volume of food intake, making them feel full very quickly, but it also limits the body's ability to absorb food, helping with weight loss as well.
But when we divert food away from the main part of the stomach in the first part of the small intestine called the duodenum, it really has a dramatic impact on type 2 diabetes. Because type 2 diabetes is insulin insensitivity, your pancreas still makes plenty of insulin, actually probably more than you would need, but we're not using it appropriately. And we divert food away from the duodenum, that's where we see a dramatic improvement in type 2 diabetes. So for gastric bypass, 3 ways it works. Restriction, less food's gonna fit in there. malabsorption, you're going to absorb fewer calories, and then the endocrine effect. Gastric bypass is a very safe procedure, but it's a little bit more complicated, and so we do have some issues with bypass that occur more frequently than any issues that we see with sleeve. The most common issues tend to affect where we attach that small intestine up to the pouch of the stomach, because that piece of intestine is not used to being exposed to any acid, so it's very sensitive to that acid, so it increases your risk of developing an ulcer there. So there's about an 8% risk of ulcer after this operation, and that is greatly exacerbated if there's any exposure to tobacco, steroids, or common over-the-counter pain medicines called NSAIDs. And with gastric bypass, it's imperative that you don't smoke after this operation, because if you combine tobacco with a gastric bypass, we're going to end up with an ulcer at that connection where we put the small intestine to the pouch. So that's the most common problem after a bypass. Also, we can see a narrowing of the opening where we connect that piece of intestine to the pouch. That's called a stricture. When the strictures occur, they generally occur in the early perioperative period within the first few months, and we can typically treat those endoscopically in the GI unit without having to return to the operating room. With bypass, there are also some long-term risks that go with rearranging the small intestine called internal hernia formation, and that's just where the intestine spins on itself, where we have divided it and put it back together. And that risk, of course, doesn't exist with a sleeve because we've done nothing with the small intestine. The other issues that are unique to a bypass have to do with vitamin malabsorption. Vitamin malabsorption occurs more often with a gastric bypass because we absorb different things different ways from different parts of our small intestine. So that first part of the small intestine that the food's not going by is very good at absorbing things like iron and calcium. And so we have to follow many of these levels lifelong after a bypass to make sure that our calcium levels, our iron levels, and other vitamin and mineral levels don't get too low. With gastric bypass, the initial weight loss is typically a bit quicker than it is with a sleeve gastrectomy. So you usually lose up to 50% of your excess body weight loss in the first 6 months. And most patients after a gastric bypass achieve about a 70% excess body weight loss by the end of 2 years. After a gastric bypass, once you get in that 2 to 3 year window, there's typically somewhat of a weight regain of a few BMI points as the body has fully adjusted to the changes that were imposed by the operation. So if you start to look at excess body weight loss out 5 years, it's very similar whether you have a gastric bypass, a sleeve gastrectomy, or a different operation, so that most patients maintain an excess body weight loss of around 50 to 60% of their excess body weight after these operations. We also perform revisional bariatric surgery here at Memorial Health. Dr. Kelly and I both had the opportunity to train under national experts. He trained at Vanderbilt and I trained at the Cleveland Clinic before we came back to practice. Revisional surgery is more difficult than primary surgery. The reason it's necessary are people have had surgeries that no longer work for them or have had trouble with it, or that procedure ended up being outdated and needs to be changed. So Dr. Kelly and I both have the expertise to take those operations, figure out what's going on, and convert them to a more reliable and safer operation.
I had gastric bypass in January of 2011. I'd gotten tired of being morbidly obese and getting stuck in booths in restaurants and that sort of thing. So I decided that was the route that I was going to take. And so I came to the info session at Memorial and began the process, and actually had the surgery in January of 2011. It was a good experience for me. Probably the worst part of it was waiting so long to have it done. I feel like it's given me my life back. I don't have to go to the big and large part of the store anymore or order my clothes online. Plus, it really got rid of all the comorbidities that I had. I had high blood pressure, I was a type 2 diabetic, I had sleep apnea. All those things have resolved themselves in part because I've lost over 200 pounds. So it's been a godsend for me. I did have some plastic surgery and had some excess skin removed. So it just seems like I'm a new person, and I'm active, and doing things that I just wasn't able to do before. The staff here have been great. The nurses and the doctors have been there when I needed them, and there were times when I needed them. It wasn't a trouble-free surgery, but I kept my eye on the prize and achieved what I wanted. But every time I needed something, they were there. I mean, whether it was medication or just an office visit for a follow-up, they were there. I think what I would tell someone who was thinking about it is, don't think about it, do it. It'll change your life. You'll be a new person. You'll feel better about yourself. You'll look better. I don't pay much attention to the numbers on the scale. It's all about how I feel. And I think that anybody considering it should do it now. Don't wait. Get it done.
Hi, I'm Anissa Grantham, Bariatric Coordinator and Licensed Counselor. I'd like to take some time to explore what to expect as you progress through the bariatric process. So let's talk about what sets us apart. We are more than a surgery center. We are a comprehensive bariatric program. You see, you are more than your weight. Our goal for you is to improve your overall health and your quality of life. You woke up one day and became the most important person in your life. You deserve to live the life that you want to live. As you progress through our program, you will be meeting with our team experts. You've already met the surgeons. Once you complete the information session, your benefits will be verified by our insurance specialist. From there, you'll be meeting with one of our dietitians. The dietitians will introduce you to the bariatric meal plan. You will be expected to be following the meal plan, heavy dense protein, and vegetables. Our expectation for you is that you want to change. You are a bariatric patient today, not when you have surgery. I will introduce you to the success habits of weight loss surgery patients. This is an evidence-based curriculum that will introduce you to 6 key principles that, when practiced consistently, can lead you into long-term maintenance. Your team also consists of the exercise physiologist at Fitness One. You will learn how to implement exercise and daily activity into your life. Movement is going to be important. Surgery will do what surgery does, but you will be required to move your body. Research tells us that those who are successful long-term need ongoing support, and that's exactly what we provide for you. We have face-to-face and telephonic monthly support groups led by our dietitians and by our licensed counselor. We also provide for you seminars throughout the year, introduce you to plastic surgeons that will assist with education on excess skin, cooking classes with our dietitians, how to meal prep and plan ahead. During the education process, you will learn about the 2-week liquid diet, what to expect during your hospital stay, and what to do once you get home. What is unique to our program, we have a bariatric surgical unit. You'll be working with dedicated bariatric nurses that will help you during your stay here. A psychological evaluation will be required as part of this process. This will help the treatment team identify high-risk factors that may impede progress post-op. Please understand that additional counseling may be necessary. We are treating your entire person, and emotional wellness is significant when dealing with long-term bariatric patients.
Hi, my name is Lizzie Parnell, and I'm a patient navigator here. My job is to help get you through this process and on your way to surgery. One of the most common questions that we get is, what are the out-of-pocket expenses associated with bariatric surgery? The first expense that you will encounter is the Success Habits Workshop. In this class, you'll receive education materials and tips to being successful long-term after bariatric surgery. The second expense that you will encounter is the exercise class. The exercise class is held 2 weeks after your surgery, at the same time as your post-operative appointment. This class is held at Fitness One, and they'll teach you different simple exercises for bariatric patients and kind of teach you to be healthy all around after your surgery, which is the goal. As you know, everyone's insurance is different. Your deductible and your copay are specific to you and your insurance carrier. My best piece of advice for you is to go ahead and call your insurance company. Find out what your specialty copays are and what your deductible is, which you will have to meet before surgery. One of the first things that we will have you attend is a nutrition consultation. This nutrition consultation will teach you different foods that you can eat after surgery and different ways to make your bariatric surgery be more successful. This class may be an out-of-pocket expense depending on your insurance. If you have any additional questions about what your specific out-of-pocket expenses are, please call our office and we can go through this in detail with you.
The keys to your success after you've had this surgery start with keeping up your follow-up appointments. That team that I described to you in the beginning of the presentation is here for you. So if you're having issues, let us know. Let us help you through this process. We've seen the hurdles before. We can help you get through them. Don't feel like you have to do everything yourself. Also, cut your food into very small bites. Put your fork down in between bites. Chew your food very well, and remember, protein is your friend, carbohydrates are your enemy. Those are the keys to success after this operation.
The next step is to call the office, set up an appointment to meet a provider. At that point, we create a checklist or a pathway that the bariatric patient goes through. Having completed that pathway, we proceed to surgery. I always tell my patients that process is so important. With any patient, we can create weight loss, but what's just as important with weight loss is long-term weight maintenance. Thank you again for your attention. I look forward to meeting you soon.